We are very pleased and honored to have Dr. Merije Chukumerije from Cedars-Sinai Cardiovascular Medicine. And I will leave it to you, Doctor. Thanks for being here with us today.
Absolutely. Thank you, guys. Everyone able to hear me okay?
Mm-hmm.
All right, great. So I thank you guys for inviting me to speak today. Obviously, this is a pretty important talk and something that's near and dear to my heart. And hopefully I can provide you guys with some information that you're able to implement into your lifestyles, particularly while we are, although nearing the end, but still in the midst of this pandemic. So with that, let's get started. Next slide. So I have no disclosures. Next slide. So is the pandemic over? It's a question that it's kind of are we there yet, right? We keep asking ourselves this, and as we continue to look towards the end and as we get nearer to the end, it's important for us to see everything we've been through throughout this time. So, I mean, it seems like 10 years ago now, but it was just a year ago, almost now. Since February 25th, the CDC says that there's a coronavirus that they termed COVID-19, coronavirus disease of 2019, right? And they stated that this was heading toward pandemic status. Hadn't quite yet said we're there yet, but it was headed towards that way. Fast forward a couple weeks later, on March 11th, we find that the WHO declares COVID-19 a pandemic, and there it is. We're in the midst of it, right? It's here. We hadn't initially expected it, but it's here now, and all our lives as we knew it have forever been changed. And we fast forward just a week later, and California becomes one of the first states to declare and issue a statewide stay-at-home order, right? And that stay-at-home order was huge for all of us. It changed everything that that we did, and the way that our mindsets were set up. It changed kids, adults, those who had jobs, those who did not have jobs, the economy forever. Everything was changed with this stay-at-home order. And that leads us into where we're going next. August 17th, that's when COVID-19 becomes the third leading cause of death in the US. The third leading cause of death in the US. That's a huge accomplishment for a disease to be able to do something like that. And it's taken many of our other disease processes and bad things that occur to all of us in the world to be able to reach the status to make the list of leading causes of death on the CDC website. So for COVID-19 to make that within a couple months time frame is a huge feat, and something that I don't think that we take seriously enough, but it's also very hard to put things into that perspective until, again, we really look at what that means, and we'll talk about that in a little bit. Come September 28th, the globally COVID-19 deaths surpassed 1 million, right? And when we look back on our timeline, the first COVID death that hit to September 28th, and globally 1 million people have passed from this disease. It tells you just how significant this disease has been, how deadly, how virulent, and how problematic it has been. Not only for those with underlying conditions, but as we know, for some healthy individuals as well. We fast forward and we start to see some light, however, in December 2020, when the first vaccines are administered. And thankfully, there's some light at the end of the tunnel, and we start to open our eyes to the point where we are today in February of 2021, when nearly 30 million people have been vaccinated so far, right? 30 million people have received at least one vaccine. Of that, about 6 million have actually received both doses. So we're making progress. Next slide. So that tells us we've come a long way since that during this timeline, since that initial declaration to thinking this was going to be a pandemic, to actually calling it a pandemic, to saying, okay, we're in a pandemic, let's stay at home, California and every other state, and to the point where now we're getting vaccines put in arms. And although we've come a long way, we still have a long way to go. Next slide. So in the meantime, as we think about all the things that we've been through and all the turmoil that has basically ravaged the country, we really start to put things into perspective, right? And so the perspective that we want to talk about is the leading causes of death, right? And we're talking about what are the things that we know, as not only globally, but here in America, we know these things year after year continue to lead and the damage and the I guess the demise of people that we unfortunately wish that we could stop. And that's the same thing that we think of when we come to COVID-19. So we know that cancer has been one of the leading causes of death, and it holds that #2 spot, and it has done so for years. Accidents have done that same. These are for US stats that we're looking at right now. Accidents and unintentional injuries, about 175,000 people a year died from this in 2019. If you click, Michael, click the button. We look at heart disease. Heart disease is the leading cause of death, not only in the United States, but globally. Globally, heart disease remains the leading cause of death. And again, look at the feat that COVID-19 has accomplished to be #3 now, with, as of December 31st of 2020, there were over 346,000 deaths. Obviously, we're closer to 460,000 or so now by February. And that just shows you how remarkable this has been to hold that #3 spot. And for my community of individuals in the cardiovascular space, we're now dealing with not only heart disease, but now heart disease in individuals with COVID-19. Next slide. So when we're talking about cardiovascular disease and COVID-19, it's what are the things that we're concerned about, right? Very early on in the pandemic, we started seeing data come out from China, from Italy, from the hardest hit countries early on. And they noticed that individuals that had underlying coronary disease, individuals that had underlying risk factors for cardiovascular disease, being hypertension, diabetes, obesity, these individuals were at a higher risk of having complications and death, morbidity and mortality associated with COVID-19 infection. What we saw were different types of manifestations of cardiac disease. So there were cardiac arrhythmias, which are irregular heartbeats. We saw people having increased incidences of acute coronary syndromes. So that's the typical thing we think about with the acute coronary syndrome is a heart attack, but that involves many other things. We saw blood clots, small blood clots going into the small arteries, not only causing a heart attack-like syndrome, but also causing pulmonary emboli and other complications that we see with the venous thromboembolisms. We saw heart failure being exacerbated to people with underlying heart failure that may have been well controlled prior to, but when they were afflicted by the infection, they had these subsequent complications, including direct invasion of the muscle tissue with the virus, causing myocarditis, which I'm sure you guys have heard about. There was also this theoretical risk of with medications, and there was this concern that were related to some of the most common and popular cardiovascular medications being angiotensin converting enzyme inhibitors, which are ACE inhibitors, and angiotensin receptor blocker, or ARBs. These are medications that are used in heart failure. They are used in diabetics. They are used for blood pressure. And there was this concern that because of their the relationship that the virus has with the ACE receptor in our human cells, that these medications should be stopped. Thankfully, we have seen that that doesn't actually pan out. And the recommendation at this point is to continue to use those medications in patients that require it. But however, you can imagine millions of people initially, when they started hearing this information, were very concerned. And some stopped their medications, which then further increased their risk of developing complications. Next slide. So why is there an increased risk with COVID and cardiovascular disease? That's one of the questions that we started having immediately once we started seeing that early data come out from Wuhan, China. And so what is the infection? And at this point, we're all COVID-19 and SARS-CoV-2 experts, but we'll do a quick review of what it is. So severe acute respiratory syndrome coronavirus 2, that's SARS-CoV-2, that is the virus, correct? Which is, it's an important distinction to make from what COVID-19 is. COVID-19 is the disease that subsequently comes after affliction from that virus, correct? So SARS-CoV-2, what it does is that it enters the cells. And the way that it does that is that it binds to the cell's receptor using this key for, lack of better words, which is its spike protein. So that spike protein binds and enters the cell via the ACE2 receptor. I think if you click, Mike, it'll highlight what that spike protein is. So this is the spike protein here. And this spike protein is a key part in this virus's a pathway to afflicting complications into a patient. So if you click again, Michael, the spike protein binds to this ACE2 receptor, which is found on the surface of the host cell of our human cells, right? And when the spike protein now joins with that ACE2 receptor, it is now able to enter the cell. And when the virus enters the cell, it uses the cell's mechanics and essentially replicates itself. And it does that over and over from cell to cell until it causes cellular destruction. The reason why this is such an issue, go back one, Michael. The reason why this is such an issue is that the ACE receptor is found throughout the body. It's pretty ubiquitous in the body. And so it's found in the heart, it's found in the kidneys, in the intestines, in the pulmonary tissues. And that is why these are the organs and these are the body systems that are most commonly affected but with this infection. And so what happens is when that cell is now affected and the virus has now replicated, the immune system, your body's immune system, its defense system, does a good job of trying to protect you. And it leads to this release of hyperinflammatory processes where the body is now trying to fight this massive infection that's going on. And so as you can imagine, just like when you get a common cold with one of the other coronaviruses that we've all been privy to in the past, your nose gets all and your nasal passages get very inflamed and it's hard to breathe. That's essentially what's happening in all of these cells. And so it's a cytokine storm is what we call it. The cytokines are the inflammatory cells that come and try to do good, but just that defensive system becomes overwhelming. Next slide. So what we see within the cardiovascular system is all of these things that I mentioned before. We see acute coronary syndromes or evidence of heart attack, and these are manifested with clinical pictures such as sudden and severe chest pain. When an artery in the heart becomes acutely blocked suddenly, now there's no longer good blood flow in that artery. And the tissue, the heart tissue that artery was supplying blood to is no longer receiving that blood. And that is what causes that chest pain. We have patients that have really bad shortness of breath, which you can see with many different other processes, right? Arrhythmias, these are irregular heartbeats. Patients feel this with rapid fluttering heart sensations, palpitations. They can get dizzy because if your heart is fluttering and just beating this fast, it's not efficient in providing adequate circulation to your brain, to the rest of your body and organs. Some patients pass out and lose consciousness. As I mentioned before, the heart failure. We see heart failure being one of the major reasons for patients coming to the hospital. When your heart is no longer functioning appropriately and it's truly failing, it's no longer doing its job, which is to be a pump. Heart is supposed to pump blood to the rest of the body so the rest of the body can do its job. But because of that infection, because of the complications and the changes in fluids and that cytokine storm that I mentioned, the heart is now a progressively failing organ. And so it leads to increased swelling and increased fluid retention in the body. And you start to feel that in different ways. So you're more fatigued, you have more swelling in your legs. It's harder for you to breathe, especially when you lay down. Myocarditis is an infection or an actual destruction of the tissue, the actual heart cells due to the virus. And that can present itself in pretty much all of the ways that all the other ones did. Myocarditis can lead to arrhythmias. It can lead to heart failure. It can lead to chest pain and acute coronary syndrome-like symptoms as well. We all have heard about the increased risk of blood clots because of this virus. We call this being more hypercoagulable, and more people are having blood clots that are going to all types of places, including the heart, including the brain, including the lungs. So deep vein thrombosis is one of the major things that we see as well. And this is one of the ways that we see this is with increased leg pain, because if you have a blood clot that's starting to form in one of the legs, it stops the blood flow that was once pumped out from the heart. Everything that's pumped out from the heart now needs to circulate and come back to the heart, right? Well, the veins are the way that happens. And if you have a big clot in your veins, then it's very hard for that blood flow to return to the heart. And that's why we start seeing swelling in the legs. We start having pain in the legs. We start seeing redness in the legs. And if that blood clot that was in the legs or any other vein were to go to the heart, now we have were to go to the lungs, we now have a pulmonary embolism. And that can be associated with shortness of breath and other symptoms like chest pain. Next slide. So the main thing that is important to realize is that not only does COVID-19 present itself with many types of symptoms and many types of variability in its manifestation, but so do the complications within the heart from COVID-19. So for any reason, if we're feeling any of these symptoms or if we're seeing any evidence of these things, it's very important that we go to the hospital. One of the things that was evident during this pandemic is that we've actually seen a significant decrease in hospital admissions related to cardiovascular disease and possible heart attacks. Now, you would think that's maybe a good thing. The pandemic is here, people decided to stop having heart attacks, right? Unfortunately, that's not what happens. People are still having heart attacks, they're just too concerned to go to the hospital. So what we saw was that people were having more heart attacks, but staying at home and having delayed presentations to the hospital. As you can imagine, that's not a good thing, right? So you have this heart that now had poor blood flow going to a certain area. That part of the heart that is no longer receiving that blood starts to die off a bit. And now that leads to heart failure. That can lead to arrhythmias. That can lead to sudden cardiac death. And we saw that there was a study that was done that showed that amongst 9 of the top US hospitals, there was about a 40% decrease in cath lab activations. The cath lab is where we take patients that have a heart attack. 40% decrease over the first 2 months of the pandemic. That's very, very significant. And again, it's not that heart attacks stop happening. It's that people stopped coming to the hospital. And I've heard from many clinicians, including myself, of patients who wanted to just stay home. They did not want to deal with the hospital. They did not want to risk themselves. They did not want to go there, contract something and bring it back and risk their families. So they opted to stay home. Also, if we went back to the other slide and you saw those symptoms that I mentioned, a lot of the symptoms can be symptoms that maybe someone just thought they had a cold. Maybe someone thought they had a coronavirus, correct? And what did we tell people in the beginning? Stay home. Let's bend the curve, right? Let's not overwhelm the hospital systems. So there were some patients that were being vigilant and wanting to help us out by not overloading the hospital system. Yet instead, they, were having their own issues and they stayed home. And we saw an increase in out-of-hospital cardiac arrest and other complications. So this is a reminder that if anyone has issues like this, it's very important for them to present to the hospital, especially this one that's here in this picture. Next slide. So we're talking about heart health amidst the pandemic, and you go to the next slide. What we want to discuss is everything that we should be doing, everything that is occurring in individuals during this pandemic. What we've seen over this time, and some of the few studies that have been put out thus far, is that internationally, like truly globally, we've seen decrease in exercise. We've seen an increase in the amount of anxiety that individuals have. Not to mention that the pandemic happened during the Royal Rumble of presidential elections, but there was so much going on this year that all of these things manifested in individuals. We saw people having worse sleep hygiene, and there was a lot more snacking that was done by individuals because, hey, you're home, you have access to your pantry now. You're not at work where you have to, be diligent and focus on your task and not snack until break time. And of course, the biggest thing that we saw was less physical activity and less movement, because we all became Zoom warriors, and we became so efficient at staying connected that we stopped moving as much. So we started to see a bunch of these things happening. As I mentioned before, we had the stay-at-home orders, and part of the reason that we started seeing the decreased exercise, increased anxiety, more snacking, more sleep, the less physical activity is because of everything that came afterwards. Mike, there's a few clicks you're gonna have to make to just keep on going. But we started to see all the signs come up, and the parks were closed, the gyms were closed, the beaches were closed. So it's, well, I can't go and be active anymore. I can't go for my strolls. Well, what do I do, right? And so this is pretty much what we started doing. And it was either laying on our couch with a book, it was in front of the computer, it was in front of the TV, whatever it was not doing much, right? And so we started to see that during this pandemic, the small risk factors for cardiovascular disease started to show themselves a bit more. Next slide. So we look and we think about the American lifestyle. This was data from this survey that was done by the National Health and Nutritional Examination Survey done in 2016. And it showed that if you take the average American lifestyle and break up the physical activity in over a 24-hour period, we don't do much, right? So sedentary hours take about 7.7 hours of our day, right? Then we take about another hour sleeping, another 8.3 hours or so sleeping, if you can get some good enough sleep, right? But even if you're not sleeping, then there's just the light work that we do. So the light work, we think about that like, walking around our house, or, cooking, cleaning, things like that around the house. We take another about 7.8 hours or so. So when we think about the true physical activity that we do, it's only about 0.2 hours. That's the moderate to vigorous activity. Only about 0.2 hours of our day is actually taken up with doing activity. So even for those of us that do participate in physical activity, it's not much. So all of us can look at this now and see and think about our own personal breakdown and how we lie, and wonder, are we falling within this pie chart here? Where do we fall within that? Are we a little bit more or less in certain areas? It's a good way to put things in perspective. And so the data that we've been seeing over the last few years has truly been starting to suggest that a sedentary lifestyle is truly associated with increased cardiovascular specific mortality. And one thing that's very important is differentiating sedentary lifestyle from a lack of physical activity. We used to just think, okay, sedentary means that you don't have physical activity. But this chart shows that, again, for that 0.2 hours, that's someone that was at work or was working from home, sitting on their computer most of the day. They took a couple phone calls and, were on their phone, but they did that from the couch. They made sure they got their afternoon nap in. They, make sure they did their laundry, and they, took the dog out for a walk. So they did their light work. They got some sedentary work, and they made sure they slept. But hey, they did go and they did exercise for a good 30 to 45 minutes. They got their physical activity in. They're not very sedentary, are they? Or are they? That's the question. Because we know a lot of people that go and they work out every single day. But if you work out for 0.2 hours a day, but then you're sedentary the rest of your day, then are you truly getting the benefit of living an active lifestyle? Next slide. So the one thing that we want to think about is that over the years, globally, the amount of food intake that we take in has pretty much stayed the same, but our sedentary behavior has actually increased. And so that's not a good balance. We're bringing in more food. We're bringing in about the same amount of food intake, but our physical activity has decreased, meaning that we're burning less calories, where our energy expenditure has gone down. So these are some of the things when we think about sedentary behavior that we see. And every single one of us does this every single day, does one of these things, whether it's at home, whether it's at work or school. Obviously, when you're driving to and from work, especially here in California, we're sitting in the car probably for a long time. And then even leisure activities, right? We're doing things, but it's very sedentary activity. Next slide. So that's where this thing called NEAT comes in. I don't know if you guys have heard of this. This is non-exercise activity thermogenesis. All right. It's a concept that was brought up by Dr. Brandon Levine, and it's thinking about the energy that we expend when we're not actually exercising. And it's a very important thing and a very important concept that I think all of us need to make sure that we're starting to implement, especially during the pandemic, while we're not getting to do some of the physical activity that we were doing before. So what we see is that both weight loss and cardiovascular health is related to NEAT, non-exercise activity thermogenesis. And what this is that it's a description of what spontaneous energy is. This describes the spontaneous energy that we expend from any activity that we do. And again, that's typing. That's when you go from sitting down position to standing up. It takes energy to do that. When you're talking with your hands and doing this, you're burning calories and you're using energy to do this. Playing with your kids, those things that we noticed are at our house and we're not sure why they're still there because they're not in school, right? Playing with your kids, those are ways to increase your energy expenditure. Laundry, sex, activity, all these other types of activity, even though they're not exercise, they are ways that we burn calories, and they are ways that we can improve our overall cardiovascular health. And so there's been multiple studies that have shown that people with more NEAT actually burn more calories, they lose more weight, they have leaner body structure, and they are overall more healthy. That's something that the data has shown. Next slide. This was a study performed back in 2014 by Dr. Levine in Minnesota, and they had basically they had patients or participants in the study that wore these kind of diaper ergometers, and it basically would be able to monitor every time they sat up, every time they walked, every time they performed any type of activity. And what this did was that it showed what their level of physical activity was. And they saw that, they saw that in a certain population of patients, in the lean population of patients, they were more active, right? So how many of them laid down compared to the individuals that were obese? Pretty much the same. But when it came to sitting or standing, we saw that the people that were classified as obese or were tended to be more obese sat down way more than those who were considered lean. Inversely, we saw that individuals that were more lean actually stood up or walked around and ambulated way more than those who were defined as obese. This is a good thing, however, right? Because what this does is it actually shows us that there's an area for therapy there, right? There's a point of intervention. These are individuals that lived in Minnesota, did not go to the gym. This was just normal individuals. And they showed that there was a huge difference in their body structure, their BMI, based on just their activity level, not being in the gym. So that tells us that we can just do more and still get significant benefit. Next slide. So what are some of the ways that we can improve our NEAT? Be intentional. When you're intentional about the things that you're going to do, it's very easy for you to start moving a little bit more. So if you are at work, instead of texting or sending an email to your colleague, walk over to their office, right? We talk about all the time taking the stairs instead of the elevator. Park a little further purposely from the doorway, right? Be very intentional about the activities that you want to do. When you're at home or at work, try to set task goals throughout the day. Say that every commercial break while I'm watching TV, I'm going to stand up. Again, just standing up is a huge contributor to your overall NEAT. I'm going to stand up once every commercial break. We've all watched Netflix, and Netflix had to give us the reminder asking us if we're still there, because even Netflix realized that we have not moved nor touched the remote or changed anything. We haven't even pressed pause to go to the bathroom, right? Even Netflix notices that. So be intentional about these things. Make around the house to-do lists, right? So if you're gonna do laundry, make sure you actually do laundry that day. And do laundry downstairs, but then take your clothes upstairs to fold them so that you have to walk up the stairs. Little things like that are going to improve your NEAT. And they seem like small things, but they go a very long way. The other big thing is to hold your family members accountable, right? This is a situation where now it's very imperative that you have your husband go outside and mow the lawn. Why? Not to make the house look better, but to improve their NEAT. You're helping them help you. So it's a very important thing that we have to do. All right, next slide. When we talk about exercise and what are our exercise goals, right? So exercise goals for us, the physical activity guidelines and the American Heart Association has recommended that adults should engage in about 150 minutes of moderate intensity activity per week. And that sounds like a lot, but if you divide that up by the week, that's about 20, 30 minutes of moderate physical activity a day. Or if you decide to go a little harder and do vigorous activity, you only need 75 minutes of exercise a week. That's a very easy goal to hit. Again, be intentional, set these goals. Next slide. And again, when we're talking about what are these different types of activities and what is moderate, what is vigorous activity, this is a good slide to try to break that down for us. Sedentary behavior is, as we mentioned, it's sitting around the house, it's reclining, it's watching TV, it's reading your book. And then we talk about the light activity. That's doing some of those things that are contributing to your NEAT, right? So walking slowly in the house while you're on the phone, cooking, doing light housework like laundry. And then we start to step it up a little bit, okay? Because I always tell patients every time they come and see me, and I ask them, what do they do for exercise? And they say they go for walks. I'm like, that's great. I want you going for walks because walks are improving your NEAT. Walks are good physical activity, but walks are not true exercise, right? I want you truly getting your heart pumping, getting your blood flowing. Those are the things that are contributing to your overall cardiovascular health. So that's when we get into the moderate intensity type of exercise. That's going for a brisk walk. When my patients tell me they go for a walk, I say, well, you go for that walk, but make sure you add some power walking to that, right? I want you to be a little tired at the end of it. That's biking. That's even dancing in the living room, things like that. All right, then we get into the vigorous activity. That's when you're really expending some energy and burning calories, and that's doing more intense activities. These are the different scales of activities, and you see some examples there on the side of things that you do at home, including the cleaning and the washing the car and playing with the kids. Like if you go next slide, we also see things that are related to actual sports and some of the leisure activities, and we see how these things also contribute to increase in that energy expenditure. And you see how the more intense you get with some of these activities, the more calories you're burning. Next slide. We also see that when you're actually getting into formal exercise, there's different types of formal exercise. There's much variability in all the things that we do. And so you need a variety of all these things. There's not one size fits all. You need to be able to utilize what you have. And it takes us to the next slide, in that we've all known that the gyms are closed, the beaches are gone, our walking paths are gone. So what do? Well, you have to use what you have. You have to use the equipment that you're available with. And at times that's no equipment, right? Not everybody, I'm not sure if anyone tried to purchase any medical or health weight equipment or anything like that, but they were sold out for a while. Once the pandemic hit and the gyms closed, everyone started buying up things. This is great, right? However, that's limiting to what some people have. One of the main things that I hear from patients after the pandemic started is that, oh, my gym closed. So that means they stopped working out. But you have to use what you have, and you don't need any equipment to have a great workout, right? You can be in the middle of your living room. You can go to an empty park now that parks are open again. You don't need much equipment. You don't need any equipment. You don't need much space, actually. You don't need a huge field. You don't need anything but a 4x4 area. You need some dedication. You need some accountability to actually reach those activity goals that we want you to reach. Next slide. And one of the other things that we hear all the time is with exercising is that people don't know how to do it, right? Or what type of exercise should I do? And so interval exercising is actually one of the best types of exercise that someone can implement. And why is that? Well, with interval exercising, we've seen that it's very effective at improving our overall cardiopulmonary fitness. And with physical exercise, there comes a lot of different variability. One thing that we know about physical activity is the fact that it's more time efficient, right? What you do is you go hard for a period of time, and then you bring that down and go back to a baseline. And then you go hard again, and you bring that down. And we've seen that with this intermittent high and low type of activity, that we've seen actually a superior benefit in this type of exercise compared to the more traditional, continuous, moderate intensity, go for a long run type of exercise. More and more data is coming out to show that that's actually more beneficial. And so what that does is that type of interval exercising really allows for more variability, which can make it more fun, but also which can make it more efficient to allow us to actually get that activity in throughout the day. So you see an example here of what interval training is, and you have this time frame where you go for your normal walk that some patients tell me they go for a mild walk. But during that walk, as I tell my patients, when you hit the next block, I want you to go at a faster pace. For 1 minute, go at a fast pace where you're pumping your arms, when you're really huffing and puffing, and then you get to the next block and then you slow it back down, okay? And then when you hit the next block, same thing, pick it back up, you go hard, and then you bring it back down. And if you do that, you notice that your heart is truly working a bit harder, and it's getting that additional benefit of improving its cardiovascular and cardiopulmonary fitness. And you'll notice that at the end of it, you did it in a shorter time, you felt more efficient, and you got in a great workout. Next slide. And a type of interval training that we've all heard of is HIIT training, correct? High intensity, I see some typos here, high intensity interval training, right? And again, we go back to the number one excuse for lack of exercise being that we don't have time. I think if you click next, we don't have time, right? And oh, sorry, go back. One thing that I've truly seen the biggest benefit with is the fact that this can truly answer that lack of time problem. And as I said, before, we've seen that even with a short amount of time, hard hitting, high intensity exercise in a short time period, be it 1 minute, be it 5 minutes, 10 minutes, as opposed to a 30-minute run, that you can have significant improvement in your cardiopulmonary fitness when you compare that to the traditional way. We've seen that in diabetes, this reduces insulin resistance. We've seen improved vascular function with people who do high intensity type of training compared to people that do continuous exercise training. Next slide. And then the other important thing that we always have to mention as well is nutrition, right? You've all heard that abs are made in the kitchen, right? Not the gym. Same thing with high intensity exercise and cardiopulmonary fitness. This is a huge part of this also comes from what we do in the kitchen, how we eat. It's complementary, has to be synergistic. You can't do one or the other. All right, before this talk, I had a patient that I just saw who was diagnosed with coronary disease, and they were just so concerned about it. So the question was, well, what will I do and what can I do? Well, we take a look at all his risk factors, and cholesterol is, through the roof. He was significantly overweight compared to what his ideal body weight should be. His lifestyle was admittedly very poor. And we talked about the significance of adding not only nutrition, but also that exercise. This is 3 months later. His cholesterol is down over 80%. His LDL is way below our target goal. He's down 30 pounds. These are things that you have to do. These are things that we have to implement, again, synergistically. It's not just exercise. It's not just nutrition, but both together. So when we talk about exercising, there are a lot of different things that we can do. But when it comes to nutrition, it's pretty straightforward, right? Now, don't get me wrong. There are so many diets out there. Nutrition is a very complex issue. But the number one thing that you have to have is the dedication and the interest in improving. And so what this pandemic has allowed us to do is actually it's provided more opportunities for us to cook at home, right? We can't go out to restaurants more often. So we're actually seeing a lot of people cook at home. That study that I mentioned in the beginning actually touched on that was one of the benefits that most people found. They stopped eating out as much, they cooked at home, and they saw new opportunities. One of the main opportunities that I think that people started to delve into was the plant-based diet, which is a highly recommended diet, particularly one that I mentioned to my patients. Now, I completely understand that it's hard to go full plant-based, which is why I recommend a plant-predominant diet. You don't have to do everything in full force. I tell everyone everything in moderation. However, implementing this slowly into your diet, you'll start to see true benefits. One site that I found very helpful is veganwary.com, and they kind of help you implement the vegan lifestyle into your diet. It helps you to go grocery shopping. It shows you some of the alternatives. I think the hardest thing with these diets is that we don't know what I should eat and what we shouldn't eat, correct? And so just getting some of that support, I think, is helpful. Implementing more whole foods and legumes, high fiber, low fat. Those are the things that we need to make sure we're doing. And this is the pandemic has provided a great opportunity for us to implement some of these things. Next slide. And of course, as I mentioned before, diabetes and heart disease are connected, right? They're tightly linked, but we also know diabetes and physical activity are tightly linked. So what we see is that the sedentary lifestyle truly increases your risk of diabetes. There was a study that was done that actually showed that just a 15-minute walk after each meal significantly reduced it. It halved the amount of the rise in glucose. After we all eat, our glucose levels rise, right? That's what it's supposed to do. But they saw in the study that individuals that took a 15-minute walk after they ate compared to individuals that did not take that 15-minute walk, their rise in glucose was about here compared to those that did not walk. That is something that's called your postprandial glycemic excursion. And we know that the postprandial glycemic excursion is one of the biggest risk factors for developing diabetes. So this is something we should be implementing during the pandemic so that we can reduce our risk of developing diabetes, which will reduce our risk of developing subsequent heart disease. Next slide. And hypertension. Hypertension is one of the most common diseases that we deal with, and obviously it's very tightly linked to cardiovascular disease. And what we know is that all forms of physical activity can lower blood pressure. I'm one that does not like medications if we don't have to. So one thing that we need to make sure that we're doing is taking advantage of the non-pharmacologic interventions that can help lower blood pressure. Physical activity lowers both systolic and diastolic blood pressure. Okay, one thing that we have to realize. The other thing is alcohol intake. One of the other huge spikes that we saw during the pandemic was the increase in sales of alcohol. Naturally, we're at home more, right? Everyone's trying new cocktails and everyone's a mixologist now. Well, with that alcohol intake also comes a rise in blood pressure. So alcohol moderation and making sure that we're focusing on reducing our alcohol intake is another way to prevent and control our hypertension. And then of course, just the adherence to the pharmacologic medication, the prescribed blood pressure pills that we're already on. Again, majority of the country already has heart disease. So it's not only about preventing future heart disease, but also controlling the current heart disease that we have. Next slide. So with that, it's the big thing that I want us to realize is that there's a lot of things that we can do with during this time. And there's a lot of focus that we should be having on our cardiovascular health as it's linked to this pandemic. And the biggest thing that is important for us to understand is that the moves that we can make and the progress that we can look forward to are things that are going to take not only our dedication, our focus, but also a team-wide approach. And so for anyone that has concerns, anyone that has questions, make sure you're consulting with your healthcare provider, making sure that things that you are considering trying, new opportunities, new diets, new exercise regimens, the medical team is here. That's why we're here for you. Don't stay home. Don't stay home with that information and decide not to share it with your provider because you think we're too busy or overbearing us. That's what we're here for. Next slide. And I think just some huge take-home points. So, Mike, if you go one by one, one thing that we need to realize is that any activity is a good activity, right? So doing something is better than nothing. Okay, next slide. We'll see that by hitting our exercise goals, and if we be intentional and try to ask ourselves, come Monday, we do 15 minutes, right? 15 minutes somewhere, okay? Then Tuesday, you do another 10 minutes, add 10 minutes somewhere. And throughout the time, make sure that you are adding up and seeing, am I hitting my recommended goals of 150 minutes or 75 minutes of vigorous activity? Next. One big thing that we should realize is interval training is more time efficient. We don't have time. We have Zoom meetings from 8 to 5. Make sure you get 10 minutes of interval training in there. It's very beneficial. Prevention is better than rehabilitation. That's, self-explanatory. If we can prevent some of the disease, we don't have to worry about trying to get you better after that heart attack or stroke, right? Again, the pandemic offers some great opportunities to implement new diets, new exercise regimens. The big thing is that you just have to start. And for those who are already doing it, there's always room for improvement. And biggest point is that you don't have to do it alone, and that's what we're here for. So make sure you're consulting with your healthcare providers for that. And with that, again, I thank you guys so much. And any questions?
Okay, everybody unmute and a round of applause. That was wonderful. Thank you so much, Doctor.